implementation of integrated public health program in sub-Saharan Africa. She has hands-on experience in primary healthcare methodologies with a particular interest in primary healthcare and health systems strengthening in Africa. She is currently the program manager, public health emergency response at Amref Health Africa in Kenya. She has an experience providing leadership to development projects in Kenya, Uganda, Tanzania, Rwanda, Namibia, and Botswana. She's also a technical expert in health leadership, management, and governance, LMG, offering learning, mentorship, and coaching to teams in public sector and partners in Africa. She's also leading the Women in Global Health Africa Hub Secretariat at the Amref Health Africa. At Kenya national level, she's a member of the Universal Health Coverage UHC Human Resource for Health HRH subcommittee in Kenya, which provides advisory and technical support to the UHC steering committee in the development of relevant policies and strategies to enable the development of competent HRH. She has previously held leadership roles in Amref Health Africa in Kenya and the College of Ophthalmology of Eastern, Central, and Southern Africa, where she was coordinating projects in infectious diseases, capacity development, water, sanitation, and hygiene, and non-communicable diseases. She has experience in community development, health system strengthening, advocacy, and development of strategic partnership within the health sector in sub-Saharan Africa. She would present the topic, Building Climate Resilient and Sustainable Health System in Africa. Please make welcome Sarah Kosgei. Please, you have the floor.
Thank you so much, Mr. Moderator, and thanks to all the presenters who've gone before me. And so I will try not to repeat what has already been said, but just reiterate some of the things that we will require to ensure that we are building a climate resilient health system in Africa. And looks like my slides are not moving. Yeah, so briefly about Amref Health Africa, if you haven't had a chance to interact with Amref Health Africa before, is we were founded in 1957, so we have 60 plus years and we are running programming on health in Africa. And at the moment we are in 35 plus countries in sub-Saharan Africa, but also have country offices in 11 of those countries. For where we don't have offices, we work with development partners and local implementing partners within the region. And at Amref, we are cognizant that we have to work towards lasting health change in Africa. And we have that mission to ensure that we are increasing sustainable health access to communities in Africa through solutions around human resources for health, health service delivery, and this is looking at the whole aspect of from reproductive health, child health, HIV, TB, and malaria, and to ensure that health services delivery is given at the last mile, but also in investment in health, because for a long time we've seen that health being a problem worldwide, then the funding that we get for health and ensuring that we are reaching the people at the last mile is a little limited. And so what Amref does is working with communities at the last mile to ensure that we have lasting health change in Africa. And we've realized as Amref that we cannot talk about lasting health change if we don't tackle climate change issues. And climate change, I think, has been mentioned by the speakers before me, is that we cannot, at the end of the day, say we're fully healthy if we are not going to tackle climate change, because we've seen how climate change is influencing our health every day. And it's even getting worse as we move along with the pandemics coming in here and there. And so we are not able to constantly provide the best quality of life to our people. And so I don't want to dwell on this too much because it's already been mentioned by the speakers before me. And just to show the impact of climate change is that 250,000 plus people die every day annually because of related to climate change. We have undernutrition, heat stress, diarrhea, and we're losing billions of money going through the health cost per year. And projection is that it gets worse as we move along, as also the climate change impacts continue to ravage the continent and also the globe. And so there is also that disparities in impact. We see that women and children are disproportionately affected by climate change and impacts in life. And so how can we ensure that women, children are at the center of decision making whenever we are putting together climate change actions? And so Dr. Ayo just mentioned a few treaties just before me. And if we are to build a health resilient system, we must be able to be guided by those international covenants and policies on climate change and health, and also ensuring that it's a human right. And I think even the moderator just reiterated a few minutes ago that it's a human right to be able to get the best quality of life. And also in terms of climate change, how can we ensure that we are responsive to what is required by the communities that we are serving? And of course, WHO has given us strategies and outlined the things that we need to be doing to be able to combat climate change and health. The Sustainable Development Goal 13, as all of you may know, takes to member states to say urgent action needs to happen to combat climate change. And this includes strengthening resilience, adaptive capacity, and also integrating climate change measures into national policies and planning for it, but also funding for it, because once you have the policy environment in place, you also need to ensure that that is being disseminated and planned for and also implemented to improve education and on mitigation, adaptation, and early warning for climate change. And so what are these priority actions that we must consider if we are to build a strong, resilient health system? Number one would be understanding what are these vulnerabilities. What is the challenge? How are our health centers equipped or health facilities equipped? How is our health system equipped to be able to handle effects of climate change? And so surveillance is critical, and that early warning to ensure that we know what the problem is and we are ready to be able to tackle that problem. And so surveillance is critical if we are to build our strong systems, but also partnerships. It's all hands on deck when it comes to climate change. We are not only going to say we're going to leave climate change for the environment sector or to say the water sector. We've seen, even it came out very strongly during COP26, that health is being influenced by climate more than ever. And so how can we continuously ensure that we are partnering and collaborating with stakeholders? It's a multi-sectoral approach. How can we bring together all the stakeholders from national level to regional level globally to be able to cultivate? Because if we are to get to net zero, it's not going to be one partner working on it. It's all hands on deck. And the other one is, of course, climate resilience and adaptive health, and linking this to programming. Dr. Abu already mentioned about One Health. And so how can we connect One Health, universal health coverage, and climate change interventions whenever we are implementing? And so this is also where we're talking about the health workforce, as mentioned by Jenny earlier. How can we ensure also that we have health facilities that are actually using renewable energy? How can we manage our waste management at facility level? And how can we ensure that we have systems that are able to withstand the climate change effects and even the next pandemic? We see COVID-19 came. Already our health system in Africa was suboptimal. And so 2 years, going 3 now after COVID, we've been taken back a few steps back, and climate change is not waiting for nobody. So we already have those impacts of climate change happening on top of what COVID is doing to the health system. And so if we do not act now as actors, states, national governments, and also the region, we are going to cripple our health system. And so we need to bring partners on board. We need to surveil, we need to be prepared. The other one is financing. Climate change financing, I think Jenny even mentioned about the available offers for funding, and you'll find that it's really limited. And it is our hope that this can be increased as we move along. And yet we need to act now if we are to see better health systems in the future. And so we need to mobilize resources and provide the resources for financing and integrating this to the health programming that we're doing. Nothing siloed, we have to integrate, because then silo effect is not going to help anyone and we're going to waste resources. So how can we work together and ensure that while we are getting funding for health, we ensure that also climate change is included in there. And finally, number 5 is research. We have to continuously innovate. We have to continuously learn. We have to continuously ideate to be able to give those, to bring strategies that are going to help us move towards net zero as fast as we can. And so we have to invest and promote evidence-based programming. I think Jenny earlier mentioned that researchers, even from Africa, is very limited around climate change. So how can we continuously make sure that we have resources put aside and we are actively seeking out to churn out knowledge and also share the same knowledge with other people of like mind, so that we are able to work together towards improving our health systems towards climate change resilience. And so together we can. And Africa must come together to develop a system that is resilient to impacts of climate change. And this is a call on all actors. We're calling the ministries, energy, industries, wash, agriculture, food systems, housing, civil society, and also the private sector. No one should be left behind in this coming together towards strengthening the health system. And thank you very much for listening. I'm happy to take any questions after this. Over to you, moderator.